New at 10, people who continue to suffer debilitating symptoms after recovering from COVID have what is called COVID long haul syndrome.
But now a South Florida doctor is giving them a healthy dose of hope after an 8-week clinical trial. And I-Team's Kevin Ozebek with this story.
This is Eli Musser in early March. He was weak and had trouble walking. He had lingering COVID symptoms, even though he caught the virus almost a year earlier.
It just feels like I weigh 1,000 pounds, and shortness of breath, absolutely debilitating.
But now, Eli is starting to feel like his old self again. He is taking part in an FDA-approved trial for the drug Leronlimab.
How are you feeling? Better every couple days. I notice an improvement.
Dr. Norman Galis with arthritis and rheumatic disease specialties conducted the trial. It was a double-blind study, meaning half the patients received Leronlimab, the other half got a placebo, which contains no medicine.
This study was very challenging because of the complexity of the long hauler syndrome, because of the unknown nature of the drug, ultimately because we were dealing with a double-blinded study where to this day we still don't know who was on drug and who was on placebo.
Once a week for 8 weeks, patients came to the clinic for the injections. Some showed immediate improvement.
It's fair for me to say that when I've seen some of the patients responding, the response has been way above and beyond what you would expect from placebo.
Eli started feeling better 6 weeks into the study. Now, he's back on his feet. After an extended stay in South Florida just for the trial, Eli is excited to return home to New York with his fiancée Megan.
Just small things, making dinner. I mean, it's emotional for me. It sounds so simple, but I haven't done those things in a year. So I'm ready.
Then there are the patients who did not see improvement.
I think I'm on placebo.
Melissa Pardo was suffering from headaches, brain fog, and fatigue when she entered the trial in March.
I've had a few days where I do feel better, but then I do have, days of regression.
Still, she's working hard to get stronger and is glad she participated in the trial.
Perhaps I am on the drug and the dosing just didn't work for me, but that's why clinical trials exist, to figure out what the right balance is for patients.
Dr. Galis will find out soon who actually got the drug. After that, he hopes a new study is approved that will focus on dosing and how often patients should get the treatment.
By the end of the summer, we should be in a position, hopefully, to really be able to answer what's the best dose, and maybe that one dose doesn't fit all.
But there is something for all from this trial. Hope that someday long-haul syndrome could be a thing of the past. Kevin Ozebek, 7 News.
Well, the study results will be revealed sometime next month. It's hoped those who got the placebo will then have the chance to participate in a new trial getting the drug next time.
Next up here on South Florida's